Hi, I'm Professor Anne Tiedemann from the Institute for Musculoskeletal Health and the School of Public Health at the University of Sydney. I'm also one of the co-founders of the Falls Prevention Alliance Australia. In this series of 3 presentations, I'm aiming to raise awareness about falls in older age and what we can all do to prevent falls. In this second session, I'll be talking about interventions to prevent falls. So let's get started. Before I begin, I'd like to acknowledge the traditional owners of the land on which I am today, the Wongal and Gadigal people of the Eora Nation, and I pay my respects to elders past and present. In the previous presentation, I spoke about risk factors for falls. And what I'd like to do now is talk about the evidence around fall prevention. We have lots of sources of evidence to guide fall prevention efforts, so I'd urge you to use the evidence to guide your prevention efforts. The World Falls Prevention Guidelines were published in 2022, and I mentioned them in the previous presentation. You can see the algorithm here on the screen that helps to guide fall prevention efforts in the clinical setting. What's important to note is that exercise is recommended for all older people, not just those at risk of falls. We also have Australian fall prevention guidelines. These were updated and published in 2025. There's 3 sets of guidelines. One set focuses on community dwellers. Another guidance is around care of older people in residential aged care, and the third one is for people in hospital settings. I'll be talking about the recommendations for community dwellers today. So the first recommendation is around exercise. It's recommended that all older people in the community undertake exercise to prevent falls. It should be aiming for 2 to 3 hours per week, and it should focus on balance and mobility plus strength training. It's safe for people at a lower risk, so those who've had less than 1 fall a year, to undertake exercise in the community or safely at home. For people who've had 1 or more falls in the past year, it's recommended that they receive some tailoring with professional support to undertake exercise safely. And it should also be noted that the guidelines recommend that people with cognitive impairment can also benefit from exercise to prevent falls. However, they may need more support to undertake the exercise effectively and safely. Let's think a little bit more now about the type of exercise that's effective for preventing falls. We're looking here at the Cochrane review of exercise for preventing falls in older people living in the community that was published a few years back. It identified 108 randomised controlled trials of exercise compared to no intervention. This was included over 23,000 participants, so it's a large volume of evidence. And overall, this Cochrane review found that exercise was associated with a 23% reduction in the rate of falls. But importantly, not all exercise types were equal. What it showed was that exercise must challenge balance for it to have an effect on falls. And what we mean by that is exercise should be undertaken in a standing position. There should be movement of the centre of mass. We should be trying to minimise upper limb support, and there should be narrowing of the base of support, so bringing the feet closer together or standing on one leg if possible. So we really do need to be focusing on promoting exercise that has this high challenge to balance if we are to prevent falls. Within the Cochrane review, there was also some subgroup analyses that were undertaken. And what they showed was that there was no difference in the effect on falls between trials that only included participants that were at an increased risk of falling compared to trials that recruited general samples of older people. So what this result means is that we should be promoting exercise to everyone, not just people who've had a fall previously, because we know that all older people can benefit from this type of exercise. The second subgroup analysis looked at trials where interventions were delivered in a group setting versus those delivered individually, one-on-one. And again, they found there was no difference in the effect on falls between these two groups. So what this means is that we should be giving older people a choice as to what they prefer, whether that's exercising in a group setting or individually at home, for example. And lastly, the subgroup analysis that looked at trials where interventions were delivered to people aged 75 years and older compared to those delivered to younger people. Again, there was no difference in the effect on falls. So what this means is that older people of all ages can benefit from this type of exercise. So simple strength and balance exercises that are practiced regularly are one of the most effective ways to reduce the risk of falls. So what we know is that exercise needs to be performed regularly and for a long period of time. So it's important to make exercise a lifelong habit. It's not effective to be promoting, a 3-month program of exercise and then for the older person to stop exercising. It needs to be ongoing for the benefits to continue. And as we said, a higher dose of exercise is associated with a greater impact on falls. So we should be aiming for people to be performing around 2 to 3 hours per week of this type of balance and strength training exercise. It's important when talking about exercise to older people to emphasize that it's not only important for preventing falls, but exercise helps with staying independent, living longer at home, taking part in activities that they enjoy, and managing day-to-day life, because these things might be more motivating than simply telling a person to take part in this type of exercise in order to prevent falls. So the conversations that we can have can be around staying active, staying strong, moving daily. We can be talking about preventing falls, of course. We should emphasize that people should start with small amounts and gradually build up. So maybe 15 minutes a day and then gradually increasing as the person is able to. And we can be talking about why this is important. So we can demonstrate that improving balance and strength makes everyday activities easier. This is important for building people's confidence and allowing them to continue to do the activities that they enjoy, as well as the benefit of reducing the risk of an injury. So what we can see here on the screen is some examples of the types of exercises that we might be promoting to older people for prevention of falls. Things like rising up on the toes. You can note in these pictures that using a support nearby is important when the person starts the exercise program, and then we can be gradually taking away the hand support as possible. Other things like knee raises and sit to stand you can see demonstrated there. So we do need to emphasize again that challenging the balance is the most important aspect in terms of preventing falls. We also need to think about how to increase the balance challenge as the older person gets better at the activity and as it becomes too easy. We need to have ways of progressing the balance challenge, and you can see some listed here, things like standing with the feet closer together, standing on one foot, stepping in different directions are examples of what we can be doing. Again, this slide here simply gives some suggestions on how particular exercises could be progressed in terms of the intensity of the balance challenge. So for a sit to stand activity, it could be higher intensity, could be progressed by using a lower chair, using an unstable surface, so putting a cushion under the feet so the person's standing up onto an unstable surface, having the eyes closed, or using a dual task at the same time as the sit to stand activity. Similarly with an obstacle exercise, so we can be using an unstable surface, we could be using higher obstacles, or a dual task, which will all increase the intensity of the balance challenge. We do need to, of course, consider safety at all times. And here's some other images of the types of exercises that might be included in fall prevention circuits you can see here. Another important conversation is around practicing for the unfortunate event that if someone does have a fall, how are they going to get up off the floor? And this is commonly a problem that occurs only once someone's had a fall and they realize they're not actually able to get up off the floor, and this can be very damaging to their health. So this can be something we can be practicing in an exercise class, for example, the process of how to actually manage to get up off the floor if you do have a fall. So you can see the different steps here: rolling onto the side, crawling or dragging to a chair, facing the chair and getting up on one knee, bringing the knee forward, and then finally pushing up onto the chair with your arms, and then pivoting and sitting down, and importantly resting for a while before standing up. So we can be teaching older people this process. We can be getting them to practice this process under supervision, so that if the time comes that they do have a fall, they've practiced it, they have the confidence to try and get up and get to safety. Continuing on with the guidelines, so I've been talking about the guidelines around exercise, but there's other recommendations for community dwellers that don't involve exercise. There's single interventions for particular risk factors. These are things like maximising vision by having cataract surgery, dealing with foot problems or foot pain through podiatry interventions. It's important for people to have medication reviews, pacemakers for people with particular cardiac issues, maximising vision again with single lens glasses for distance rather than multifocals, and being careful if there's a change in the prescription, because there's some evidence that making too big a change to an eyeglasses prescription can actually increase the risk of falling. And vitamin D supplements for people who are deficient. And then finally, osteoporosis medication is recommended for people with osteoporosis to prevent fracture if a fall occurs. And then there's some recommendations around multiple component and multifactorial interventions. And these are really for higher risk people. And it's recommended that they have home and community safety education and exercise. And this could be in the form of the program Stepping On. And then tailored interventions after an individualised assessment by a health professional for people, again, who are at high risk of falling, and they need a little bit more individualised and supervised intervention. Some examples of what we could be talking about in our conversations with older people are demonstrating what's meant by safe shoes, so we can be having a look at that and providing information around safety and shoes. And similarly around the home, we can be getting people to have a look at their home environment and having a conversation around how to make their home environment safer. And it's good to also enlist the help of an occupational therapist to improve home safety, particularly for older people who are at a high risk. So I hope that's given you some introduction to interventions that can prevent falls in people living in the community. My take-home messages really are that falls are common, but they're not inevitable. So we need to be starting the conversation early. Don't wait for the first fall. Open up the conversation about primary prevention And in terms of interventions, we can provide this feedback to older people around staying active, ensuring that the home environment is safe, and having regular checkups. Those things like medications, vision and foot pain are particularly important in terms of reducing the risk of falling. So thank you for your attention. I just wanted to point out 2 resources here. If you want to learn more about fall prevention, the Falls Prevention Network offers workshops. You can see the link here on the screen. And if you wanted to help to spread the word about fall prevention, my colleagues and I have formed the Falls Prevention Alliance Australia as a way forward in terms of spreading awareness throughout the community about fall prevention, but also advocating for greater support and policy action on falls from the government. If you'd like to contact me, feel free, my contact email is there. Thank you.